exam with you. We already had the consultation and the story, okay? And I'm gonna be asking you a few questions, Mom, along the way. And maybe some other people are gonna get helped from the story as well. Turn around for me, please. And first thing we're gonna do is watch her walk. I can see already in the walk is there's a little bit of a shift, right? A little waddle there, Mom. It's going side to side a little bit.
I can't
This
see
is,
it.
I want you to focus here where my thumbs are. And let's do this so you can see it better. Let's mark her PSIS. So I'm talking about these dimples here. Okay, let's watch as she walks. Go ahead and walk. So it kind of shifts
Okay.
to that left side.
I see that.
Okay? Watch this left side.
Yeah.
It shifts that way to the left because the right one isn't going through up and down the SI joint the way it should. Keep walking, please. Now, as you're walking, can you tell me what you're feeling? Tell me what's going on. Tell me, why are you here? You have pain.
Well, I usually walk with my legs further out like this for balance.
Okay.
So I'm kind of like holding
Okay,
my
walk
hip.
however you normally walk, please.
Okay.
Don't do anything different. Now, do you see it, Mom? You see
Yeah.
how it shifts out there a lot?
Yeah.
Okay.
I feel unstable.
You feel unstable as you're walking?
Yeah.
Okay, keep walking, please. There's a lot of instability there, that's why. Watch her feet now.
I have watched her feet. And her knees.
So there's just a lot of instability going on, and this started, you were saying, about 4 years ago.
When she was 13. She's 19 now.
So 6 years ago.
Yeah.
Okay, and what have you guys done for this? Go ahead and have a seat over here, please.
The doctors basically said it's growing pains.
Okay, have a seat over here. So you're saying this all started about in terms of, you're here number one for these hip pains, correct?
Mm-hmm.
And you're saying this started back in 2013, 6 years ago.
Yeah.
Mom, what have you done? Why is it 6 years and she still has pain? Tell me, what are some of the things you've been doing?
Well, like I said earlier, that doctors thought it was growing pains because she did grow fast.
Okay, she's pretty tall, yes.
She is pretty tall. She's 5'9". But as the years went by, her sports, she couldn't do sports as well. She was always in pain. We did inflammation remedies.
Okay. Diet?
We've used a
CBD.
Look,
CBD oil.
look, it's all
Oh
there.
my.
It's
the
all
CBD oil for inflammation, because I know that when you use a lot of Motrin or anti-inflammatories, it's going to ruin the liver. Wow, you're a mess.
Thanks.
No, it's the sacrum. That's what I meant.
Yeah.
That's what I was trying
Thanks
to
for
tell you.
calling me a mess, Mom.
No, not you.
Here's the good part.
Huh.
Here's the good part. I'm going to start motioning pelvis and spine, okay? So tell me some of the things you did, Mom. What are some of the things that you did?
We have gone to several chiropractors.
Okay,
Some were aggressive and some were not.
okay.
We've done physical.
Did they take x-rays?
Yes, they did.
What did they, did anyone find anything in her low back?
No, they did not.
Okay, so.
We've done lots of physical therapy.
Okay, open and close. Open wide and close. Open, close. Open, close. Right side only? Keep going.
As far as it goes.
Okay, left side only. You see this disconnect. Do the right side again. She does the right, the left wants to go with it. She does the left, the right wants to go with it.
Okay.
They're both kind of fixated because we have a sacrum issue. And what I'm feeling, we're getting pressure down at S2. If I go ahead and palpate here, this is L5, this is S1, is that tender?
Yeah.
And that's S2. Is that one more tender there, or that one there?
That one.
Okay.
They're
Right.
both tender. but-
Okay, back slowly towards me. S1. That's what I'm feeling. That should be able to go back a lot further. So I should be able to bring her back here. It stops there. That should be able to come to about here.
Oh.
Okay, S2. Now, let's continue. Let me go ahead and palpate the back. Okay, so you went to some doctors. They told you what? You did what type? You did physical therapy. You got adjusted.
We saw the orthopedic doctor. They did MRIs.
MRIs of what?
The hips. They also did what did they injected you with needles? Was it a dye?
It was contrast with contrast.
Okay.
Contrast dye.
What did they find?
We went to the orthopedic, and he suggested we do surgery.
For what?
Her hip, because she has a labral tear from a hip impingement.
Okay.
And I did not agree with that because I don't believe he didn't actually have a diagnosis.
That's T10. That's T9. T9 is pretty hot, pretty tender, right?
Mm-hmm.
T9, this is the area that also helps control inflammation, energy, adrenals,
She's tired
all
all the
that
time.
fun stuff. Sorry, I'm not slapping. Okay, so I'm getting S2, I'm getting T9, a little bit here, but remember, between both of these, they're both fixated. I would go with S2. S2 and T9 are the two majors that I'm seeing. Okay, so how many surgeons or doctors did you go to for consult?
Wow.
Stand up.
It's hard to tell.
Sorry.
We did a blood test to see if she had lupus, inflammation, arthritis.
Does she?
Nope.
Okay, stand, face me this way, step back, march in place.
And
Let's watch her march. Hands on your side. And you driving what, 2 hours to get here?
Yeah.
But you know you're gonna have to drive a few times, right?
Yeah.
You okay with that?
It's better than surgery.
Well,
I don't agree with surgery.
Well, surgery is there when you need it, okay?
Exactly.
I don't know in terms of what they were trying to do. You know, they probably told you a bunch of stuff. You see, you're off balance already. These are, hold my hands, please, your hands on top of mine. Just keep marching. This is a functional test, because after the adjustment, we gotta test it. Have a seat.
They were gonna go there and explore and see what's wrong.
Okay.
Canceled the surgery. I'm getting a second opinion
For what?
for the orthopedics, just
For what?
to see if they could see anything. I mean, you obviously see it because you're.
But I look at it different, okay? What I found was a sacrum, base posterior sacrum, or S2. S1, S2, posterior. Not everyone is trained to find that, okay? That's what we found. Why don't we see what happens?
Exactly.
T9 was there as well, okay? What I would do this a little different. I would do T9 first. And the reason why, my thought process is get T9 stimulated, get the adrenals stimulated a little bit, okay? And get the body to get out of this fight or flight. She's in a lot of fight or flight right now, right? She's in a lot of fight or flight. Adrenals also control what? Inflammation, right? They give cortisone shots.
She's had those.
Okay, so that's my thought. T9, walk it off once, and then set S2, and let's see what happens. Is that okay?
When they gave her prolotherapy and PRP, they injected it into her hips.
So she had Prolo and PRP.
Correct, several.
Okay.
Didn't work.
What, out of everything you did, so you did physical therapy, you did Prolo, got some adjustments, you went for ortho consult, acupuncture,
Stem cell therapy.
stem cell therapy, this is all for your hips. Okay, and did you get any relief from any of those therapies?
Not for long.
What was the longest duration of relief that you got from what therapy?
Probably prolotherapy.
From Prolo, okay. All right, well, let's see what happens, okay? If you can go on the knee chest table on the knees. If it hurts your knees to be there, you stop and we do something else, okay? We're gonna get a deeper set there. Whatever it is, you drive in a far distance. I would rather, there's a little post-adjusting soreness like a workout, like playing a game, because of the drive, than having to keep coming. You see what I'm saying? So we'll get a deeper set there. We'll do T9. We'll have her walk, and then we'll figure it out from there. Is that okay? And if you feel uncomfortable with anything, you stop it. Okay? Fair enough? A little more. There you go. Chest here, down. Yeah, let the tummy go down, all the way down. Are you okay with that?
I guess so.
Okay, I'm gonna be up here. Hold here. Let's cover you up there. All good, Mom? Seven. 1, 2, 3, 4, 5, 6, 7, 8. Right there, T9. Now bring the knees forward just a little. Little more. Tummy down, down, down. There it is. Good. Gotcha. 5, 4, 3, 2, 1. Good stuff. Come up slowly, please. That wasn't so bad, right? Hopefully.
I just ate before this and it was like, oh, whoa.
Come on. Stand up. And let's walk it off once. Okay, let's go on the side now. You okay on the shoulder there?
Yeah.
Sure.
Mm-hmm.
Gotcha.
Holy moly.
Ah! That's part 1.
That
Part
was-
1. What happened to the other part 2, 3, 4, and 5?
We're about to do it. Stand up.
Oh, okay.
What's different? There's no good or bad, just different.
Yeah. Just different. Well,
Different. Come over here, let's go deeper.
Okay.
Because when I set that, they're gonna wanna pop up.
Oh, okay.
You're not pushing them, you're catching them. So you're
Yeah.
just gonna basically go like that.
I do that.
Okay?
no, dear.
My flying
Why
angles.
do
Slide up. That's it. Can you breathe?
Yeah.
Slide up. That's it. Oh, it so wants to go. It's gone. One more. Gotcha. Ah. Oh my hand. Walk it off. Keep walking. Several times. Just keep walking.
Just keep walking.
Yeah, several times. Now I'm gonna recheck everything and see if anything else showed up. Okay. Have a seat, please. Let's retest and remotion. So T9 is Claire. Mama.
Mm.
S2 is? Remember what it was?
No.
It was on the left about 10 points.
No.
Now, here's the proof in the pudding. Let's see. Back slowly towards me. All the way. Keep going. Keep going. That should be different now. Yes. No.
Well, my feet are touching the ground this time.
What do you mean?
Last time my feet couldn't touch the ground. So
Why is that?
I couldn't go
Because
back
they were
that-
tight?
Couldn't go back that far.
Remember I told you how far she should go back? Watch. 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 That's okay.
Wow.
Keep going.
Caitlin.
Keep going. Hi.
Good job.
Okay?
Hello.
There was no pain with that, right?
Mhm.
Pretty cool. All right. Go on your back here, please.
Maniacal.
Lift it up. Lift.
Lift.
Lift the, no, you lift the
Me?
leg.
Okay.
There. This side?
Oh, no.
That's it.
Uh,
That's
Did it
it.
hurt?
No.
no, I just suctiony.
Slide up that way. I'll use the board. When was your last cortisone shot?
When did you go to?
6 months ago. was quite a while.
Stand up, walk it off, lady. Tell us what's different.
What's different?
What's different?
What's different?
Walk it out. Look at that.
Her knees aren't bowing in as much. No,
She's not dragging her feet as much.
yeah.
Walk it out, girl. Don't try to drag them in.
How do your hips feel? Or your pain, I should say.
Have a seat.
Sore.
Oh, that's gonna be normal for a while.
Sore's okay.
Sit down.
Have a seat, please. I want to check one more thing. Right there. So, 9 and sacrum cleared, something shifted. Now we're going to the top. 6, 5, 4. Tender in there, or more here.
There.
Right there. This one's going to be light, C2, easy. Come on. Look up. You're helping too much. You gotta drop that left ear. Drop, drop. There you go. Gotcha. Alright. Alright, young lady, walk one last time, and then I want to do your hands. Actually, sit up straight. Do the shoulders and then have you walk. Over, around, down.
Is that you?
A little bit. Tell your mom what's up.
The ceiling.
Elbows. Thumb. Squeeze. Elbows. Ears. Listen to your mom. 1, 2. There.
Because I gotta listen to you more.